And I now have the great honor of presenting our third annual Gerald Gilchrist Medical Champion Award. Dr. Gilchrist, the award's namesake, unfortunately passed away last month. The Reach Out and Read program and the broader Minnesota medical community were profoundly privileged to count Dr. Gilchrist as both a leader and a friend. In his 30-year career as a pediatric hematologist oncologist at Mayo, he touched countless lives. And as a founding board member of Reach Out and Read Minnesota, he provided our organization with the leadership and vision that helped it become the wide-reaching program across the state that we are all here today to support. The award was created to celebrate Dr. Gilchrist's passion for supporting the health, literacy, and development of children. It is awarded to a Reach Out and Read Minnesota provider, one of our 2,500 doctors and nurse practitioners in the state who demonstrate the passion and commitment to this program, as well as an exemplary personal and professional medical leadership. This year, I am excited to announce that our winner is Dr. Sarah Israelson. Dr. Israelson is a family practice physician at Lakewood Health System in Staples and Motley, Minnesota. She is passionate about getting high quality children's literature into the hands of her littlest patients and in giving the best supportive guidance to her parents and their caregivers. As you can see from her patients and her families, they are deeply appreciative of her thoughtful and compassionate care. Please join me in congratulating Dr. Sarah Israelson. All right, congratulations. Are one of these for her?
Well, I am speechless, which is very unusual for me. When I got this notification, I was actually driving up to our cabin in Bemidji, and it came out of the blue from one of my partner's wives who is in charge of ordering our books. And it was totally, like I said, out of the blue. The context made no sense to me. I'm not sure what she's saying because I hadn't opened my emails for a couple of days. And so I am honored, humbled, and there's no I in team, right? We at Lakewood take this honor so deeply. So I appreciate the Gilchrist family. I'm so sad that I'm not able to meet Dr. Gilchrist. He sounded wonderful in his obituary and just a human being that would have been my kind of guy. A little bit about our health system. We are an independent health system. We are in Staples, which is a town of 3,000. We do about 400 deliveries a year, which is astounding. And so multiply that with all these kids. I am privileged to retire in a month. So our CEO said, so how many deliveries have you as a family practice doc done? And this would be totally HIPAA, but I have kept a steno book with everybody, the para, gravida, blah, 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 due date, how it was delivered, what it was, boy, girl. And I was beyond 1,300. And I mean, that's just amazing. Now, an OBGYN might say something differently, but I think that's amazing. And I'm there long enough to have delivered now the kids of kids I delivered, which makes me feel really old, but so cool. So we serve about 40,000 people with a radius of up to 90 miles, which blows me away as well. We serve two of the poorest counties in the state, Todd and Wadena. So our services are, we are highly needy services. We have about a 50% Medicaid population. So when I have the pleasure and honor to give a 6-month-old a book, and Gigi was right, it goes right in the mouth. Every time it's expected. It may be their first book that they have in their household. And for me to read it, like I've had parents who are not able to read and they're not going to come out and fess up that they can't read. So I have such great pleasure in reading. And with these masks, you'd think it would have made a difference, but they see our eyes, the inflection in our voices. make such a world of difference. I can get them to smile in a second just with my eyes or my voice. And of course, they all think, they call me Dr. Izzy. So they all think I'm crazy Izzy because I get so excited about reading books to them. I'll sit on the floor, I'll sit on the step. There I am. Oh. It's so much fun. I love it. And I'm wearing white pants today. And oftentimes white pants do not stay white because kids have their shoes on. They're kicking me. They're kicking everybody. So we are just thrilled. The biggest hurdle we had, which was not a significant hurdle, was getting your providers to buy into this. They watch a video, which is painless. And it's unique because the video we had years ago was years ago. The original Boston video, I'm not sure if it has changed since then. But, and I was just in Boston, so it just kind of reminds me of Harvard. But getting everybody to watch that video and also be as excited as I am. And we have about 15 family practice providers with equal number of mid-level providers as well. So we've got a pretty good, cool group. And these kids benefit. Last year, I think we had about 3,400 well child visits, and I think 86% of our visits, a book was given. I myself, I grew up in a family with an English teacher and a social worker. My parents read voraciously. My dad had 4 books going at once. We had, our bedtime was maybe 9, but you got a half an hour to read. So then you could stay up until 9:30, but you had to be reading in that half hour. So I started early. And I try to encourage my patients to do that. Even if they're, reading, if they're in the kitchen cooking, I say, babble the cookbook. They don't know what you're saying, but just read your cookbook, your recipe out loud. Dad, you're in the bathroom with outdoor, news, the sporting stuff, or hunting and fishing. And the bathroom is never private once you have toddlers, right? Their hands are under the door, they're, flying in. So I said, read your outdoor news and just make it fun. They don't care what you're saying, but they see that you're reading and they're going to want to read. I just, once again, there's no I in this team. Our whole group has made this a success, and I can't thank you enough. We are honored.